Good evening, everybody, and a very big welcome. So my name is Courtney Kipps. I'm a sport and exercise medicine physician at the Institute of Sport, Exercise and Health, which is part of the National Centre for Sport and Exercise Medicine. And I'm a council member of the Faculty of Sport and Exercise Medicine. And it's a real privilege for me to introduce our special guest speaker tonight. No doubt many of you will already know of him through his work as a public health physician, a writer, a thinker, an innovator, a motivator. And I'm fairly sure that he's going to have some very interesting and exciting things to talk to us about tonight. But before I go any further, can I just do a couple of quick housekeeping things? You will have noticed that you can all turn on your videos and microphones, but I'd ask you not to for the time being, please. You'll have noticed that this is being recorded. So if you do turn your camera on, then whatever's going on in the background will also be picked up. As we're going along, if you wish, write questions in the chat function. But ideally, what we'd like is for you to raise your hands at the end, and we'll ask you to unmute your microphones and to ask the question yourself, rather than me simply reading them out. But of course, if you want to write them down, I will read them out. So let me move on then. So Muir Gray is one of Britain's most senior medical figures. He was a founder member of the International Cochrane Collaboration, which is evidence-based medicine, and he was the first chief knowledge officer for the NHS. You may or may not know that he pioneered breast and cervical cancer screening, and in 2005 he was knighted for his services to the NHS. And of course, I should add that Sir Muir is an honorary fellow of the Faculty of Sport and Exercise Medicine, so we're very proud of him. Sir Muir is someone who's been thinking long and hard about how we can optimize the aging process. So much so that he's written books about it. If you think of the title Sod 70, I think you'll get a strong sense of his stance in the matter. He set up the Optimal Aging Program at Oxford, where he's even nailed his colours to the mast in the website address, www.livelongerbetter.net. So the Optimal Aging Program is designed to transform, or perhaps I should say with a bit more energy, revolutionize the way we think about aging. And a cornerstone of that program is sport and exercise. And intriguingly, Sir Muir has called sport and exercise the Elixir of Life. I'm going to hand you over to Sir Muir, and let's listen to what he's got to say. Sir Muir.
Thank you. So, the Philosopher's Stone has been searched for centuries, millennia, to turn base metals into gold and to be the elixir of life. But the elixir of life is not something you get out of a bottle. We think we've discovered the elixir of life, and it's called knowledge, and it's consumed by lifelong learning. And we need to change the way we think and behave about living longer. And I'm going to, tonight, I'm going to show you the sort of talk I would give if I were in a bowls club in Hillsborough, or because this was a lecture due to be given on the 21st of April, BC, before COVID. And if I was in a bowls club or a bridge club or a mosque in Sheffield, I'm going to talk you through the way we give the message, but I pretty much give the same presentation to professors of geriatric medicine. So I'm going to talk you through that. Then I'm going to tell you what we're trying to do to bring about the revolution. And it's great to see people here from different backgrounds and different disciplines. So let me start with the elixir of life. So, ladies and gentlemen, thank you very much for asking me to the Hillsborough Bridge Club, Bowls Club, or Mosque. And I'm here to tell you the facts of life. The birds and the bees 2.0. Now, there are only two phases in life. A phase of growth and development, a turning point, and then it's downhill all the way. There's no stable adult phase. We've moved beyond thinking about childhood, work, and retirement. From a biological point of view, there are two phases in life. Now, it's for an audience of sport and medicine, we can get some idea of what's happening by looking at professional athletes. So Roger Federer and Serena, they are probably reaching the turning point about 40. But for most of us, the turning point starts about 23, when we get our first sitting job. because the car, the desk job, and the internet are creating an environment in which we go downhill rapidly. The interesting from a sports point of view about this age of 40, there are people playing top sport after 40, and they report very interesting things. For example, American footballers, they report the game feels slower. They can see things happening and know what's going to happen in terms of the ball or opponents more slowly. But it does look as though 40 is the time. The maximum pulse rate starts to decline after about the late 30s. So that's the first fact. But, ladies and gentlemen, aging is not a cause of major problems until the late 90s. It affects two things. It affects the maximum level of ability, pulse rate, for example. So, as I say, even if you were to continue to train full time, some performance would drop off, but people are still cycling 25 miles in an hour at the age of 80. And it also affects resilience. And this is what has suddenly come to light. And we call this the second pandemic in a BMJ article. So resilience means you respond less well to a challenge, whether the challenge is a change in environmental temperature, or a trip, or lockdown. So because of aging, people recover more slowly, they may not recover at all, and they're more affected in the first place. And there's a really quite terrifying report called The Impact of COVID, produced by Age UK. A fifth of people feel less steady in their feet. A quarter of people can't walk as far as before lockdown. So the problems that I've been working on for now 50 years, with the Optimal Aging Program the last 5 years, have suddenly become much more acute. Because we're already seeing in the hospital sector and the mental health sector the impact of lockdown and isolation. So that's aging. It's a normal biological process. And there's hundreds of millions of dollars being spent on the search for the elixir of life to affect the aging process. But I don't really meet many people who want to live to 118 or 142, two of the ages which have been brought up on the cover of Time magazine or other sorts of journals where they describe what's happening. People want to live longer, better. And they can, because there are three other factors affecting us as we live longer. And the first of these is loss of fitness. So here you can see from the turning point, wherever it is, the fitness gap opens up, a gap between the best possible rate of decline, affected, as I said, by things like pulse rate, and the actual rate of decline. But the good news is, at any age, we can close the fitness gap, and we can increase cognitive reserve, because this actually applies to cognitive well-being as well as physical well-being and fitness. So that's the issue here. And now speaking to you in the Bridge Club, I must tell you a little bit about fitness, because people are puzzled. They think it's to do with young people in leotards. But fitness has two key features. The first is the maximum level of ability. And the second is the ability to respond to a challenge. So if I asked you to rise from the bridge table and run half a mile, I'd be much clearer who was fit and who was not fit. By the way, I should say, if it is a bridge club, I'm going to try and change it so that north-south gets up every time hands change, because north-south never moves for the whole evening. So here's examples of the effect of fitness. Now, the loss of maximum ability and the loss of resilience or reserve are the same as the effects of aging. And that's one reason why we in the medical profession have mixed up fitness and aging. But thank goodness we now recognize two distinct processes. Then the second thing that happens to us as we live longer is an increased number of long-term health problems. And this This tidal wave shows the number of people with 1, 2, 3, 4, 5, 6 conditions. And I've got 3 or 4. I had a stent 5 years ago for an acute MI, and I've got Glasgow lungs, which started before the Clean Air Act in 1956. I had 12 years of black smoke and 2 parents smoking Players cigarettes. So I've had bad sciatica, a weak leg. I think I also had polio in my right leg. So many of us have 3 or 4 or 5 conditions. We don't call them diseases, we call them conditions. Now, the other interesting thing to emerge in the last decade has been that the fitness gap gets wider faster after the onset of disease. And there's 2 reasons for this. One, because of the maximum ability of the body may be affected. So I lost a chunk of myocardium with my myocardial infarction. But the other reason is social, that someone sees their mother struggling to get to the shops, so they send for Ocado, not recognizing that they pay money to a gym. Remember, we used to go to gyms to train, but training and struggling are the same thing. So it's the attitudes of other people. And as you can see here, the loss of fitness may be the factor that takes people below what I call the line. Now, I've not yet got the line adopted by the International Classification of Diseases, but the line's the point at which you can't get to the toilet in time. And after that, it's game over. But, ladies and gentlemen, the good news is, no matter what age you are, no matter how many long-term conditions you've got, we can close the fitness gap and keep you above the line. So, let me now move on to speak a little bit more about what's happening outside. And I'm now speaking to you as an expert audience. One of the wonderful things that has happened has been the publication of this report called Exercise, the Miracle Cure. Exercise, I never ever thought I'd see something like this from the Academy of Medical Royal Colleges. And of course, we've now seen moving medicine developed by the faculty and various other initiatives. So we're starting to change within the medical profession. So what will that be like? Well, let me give you some examples of what the future will be like. And this is not what it looks like these days, but it's certainly very familiar to someone of my age. This is how prescriptions come. So look here. Here's a prescription for being seen by a trainer at Hillsborough Leisure Centre. Now, I should say that because we need to change the culture, I'm running a campaign against some words. I don't like the word retirement. We should call it renaissance. And I don't like the word leisure. I mean, why should we fund leisure centres? I hope to be arrested for defacing the word leisure and substitute well-being centre. And interesting, Mr. Hancock, who's of course got other things in his mind, but at last year's UK Active Summit, he said, the NHS is not paying for activity yet. And I'll come back to that in discussion perhaps. So it's also possible that the fitness industry, which I'm trying to tell them to come as a sport and well-being industry, is going to offer a significant number of hours to local general practitioners to prescribe. Now, the trainer support, of course, will have to be virtual at this stage, but you could start to think what would happen if someone who was housebound got 6 hours of a trainer making contact. Then we might prescribe walking. And this is a little book I've written called Dr. Gray's Walking Cure. And this is really the revolution. We're in the third healthcare revolution. The first was the public health revolution of the 19th century. The second was the high-tech revolution of the last 50 years, stents and transplants and MRI, which have been amazing. But the third healthcare revolution is driven by 3 forces: knowledge, citizens, and this. And this is the Active 10 app. I don't know if any of you use it, but I've been Today I've had a lot of phone calls, but I have managed 44 minutes of brisk walking. So walking might be a prescription that the GP would make. They might make a prescription of online training. And this is a new company I'm advising called Elixir, which are two physios now offering, automatically linked to the person's diagnosis, a training program. And there might also be with social prescribing. I found this in Sheffield, and it's very nice to be in Sheffield again. So this is mindful Tai Chi somewhere in Sheffield. There's an evaluation of this. And look at the age range of the people in this photograph. So what we're doing is we're introducing a link between either the diagnosis, type 2 diabetes or atrial fibrillation, and the relevant Richmond Group Fellowship, bit of moving medicine, online support, and local support. And when the GPs typed in atrial fibrillation, this will happen. Now, only 70% of people are online, but that's changing very quickly. And then there's technology. So at the top there's something called the WizDish, which is a very safe treadmill. And you can see these two people, they're using virtual reality so they can walk the Great Wall of China with their friends, or the Pennine Way. On the bottom left, this is Motitech, which is being used in care homes, and again, increasingly using virtual reality. And there's a company in Sheffield called ShapeMaster, which is adapting gym equipment for people who are not in their 20s and 30s and used to pumping iron. Now, what we're trying to do here is to get people not only more active, but more active in groups, and giving the groups a social mission. For example, to raise money for the Oxfordshire and Berkshire Wildlife Trust, or to employ young people doing environmental work. And I've got plans for the groups competing. I was speaking with McCarthy and Stone, and they had people from a number of different units. And I said to them, well, I know you people in Bourne End, the one thing you like to do is to cycle faster than those bastards in Wickham. And they all roared with laughter. So, Leeds versus Sheffield, Doncaster versus Barnsley and Rotherham. That's the way to get people motivated. So I think we're aiming for 500,000 people with a treadmill like that, and 500,000 people with an exercise bike. And you can get one. There's mine's. I haven't got the virtual reality worked out yet, but I am cycling the canals of Venice, and it's very good fun. But the key thing will be to do it with friends. And I reckon you can put a package together for about £400. So the problem is not aging. The problem is loss of fitness, disease complicated by accelerated loss of fitness. And then the third factor is the wrong beliefs and pessimistic attitudes. So we need people in the sport and exercise world to be evangelical. The Jesuits are my model. That's a good old Protestant. But Calvin used the same methods as the Jesuits. We have to change how people think. We have to rewire the brains, not only of older people, but of everyone in health and social care. And the urgency of this is getting very much greater. And as you can see, moves have been made. This is Greg White, who is an Olympic athlete, as you know. And it's great the medical profession has come up with the concept of prehabilitation. And we need to think much more radically about prescribing exercise, not just with people who manage to reach centres for sport and exercise medicine, but in every consultation. So if we come back to the bridge club or the bowls club or the mosque, here's our advice. You've got to carry on with the usual stuff, Mediterranean diet, but you've got to get even fitter. Increase strength, stamina, skill, and suppleness. Every year you've got to do more, and every diagnosis you've got to do more. You need to reduce your risk of dementia, and you need to do even more for other people and strengthen your sense of purpose. And these are the the three main means of reducing the risk of dementia. And the Lancet Commission estimates we can reduce the risk of dementia by 40%. And physical activity, cognitive activity, and emotional activity are very important. I don't know if you saw this, but this was the first editorial in JAMA, and a signal from the editors, I think. So Pizzo is a very distinguished laboratory scientist and doctor, and here was his editorial. But look at the subtitle. He never mentioned the human genome. Isn't it great? So, what should we do? Well, firstly, let's decide on our aim. And the aim is not to increase lifespan, but to increase health span and to compress the period of multimorbidity at the end of life. So how will we achieve the aim? And it's not by another reorganization. I've had 27, most of which have made no difference at all. We need a system for living longer, better. And a system is a set of activities with a common set of objectives. And this is what we're working to at the moment. And I really like the faculty to get involved, obviously with objectives number 2 and 3. But you see, activity, physical, cognitive, and emotional, affects almost all of these objectives. So this is the strategic set of objectives that everyone should adopt. And it should be delivered by networks. And the 20th century was the century of the bureaucracy. The 21st century is the century of the network, which float beside the bureaucracy. You have to have bureaucracies for things like the fair and open employment of staff, or the procurement of MRI machines, or the management of money. But these are networks, and we're now starting to build networks. Some are at a county level, like Lancashire, but within Lancashire, there's going to be 5 probably, because each of the hospitals has a catchment population. And I was discussing with Courtney in North Central London. So there's a sort of UCL, Camden, and then there's a sort of Royal Free. But then you get to, is there a sport exercise medicine department in Hertfordshire? If not, is the Royal Free looking after that, or is you? So start to think in a population way. And we've set up a college for living longer, better, because we need a cultural revolution. And a cultural revolution is to create a new culture, not the culture of care. Care is another word I'm trying to do away with. So leisure I want to do away with. I'm going to deface the Hillsborough Leisure Centre before I leave Sheffield, I can tell you. Hopefully I'll be arrested with great publicity in doing so. But care means doing things for people. But coaching means helping people close the gap between potential and performance. So how should we do that? First, there's the new language, coach, purpose. Secondly, we've got a big learning program starting for older people and for professionals, and we're going to deliver it through general practice information systems. It does mean we've got to try and get everyone over 60 online, and that is, thanks to COVID, that's accelerating. And then we've got to focus on this interesting concept of purpose. So here's the new language. Understand aging, regain fitness, improve fitness, think positive, prevent and tackle disease. This one here just showing in 1948, younger disabled people were given education to overcome their disabilities. The aged were simply given practical assistance. So we need to smash care and introduce coaching. And we have a learning program. This is aimed at older people and professionals and the leadership. And the leadership is very important. And you are part of the leadership. So we've got at the present, we've got about 16 populations signed up. And I'm working mostly with the active partnerships of Sport England, because they've got the right culture and they're not tied up with vaccination. The NHS is pretty tied up at the moment. but I'm really enjoying working with the active partnerships. And their mission will be to help us develop the networks and refine and deliver the culture. Obviously bringing in Age UK, health and social care, and local business. So, leadership. The main factor distinguishing leadership from management is culture. And the faculty is a very important part of the leadership, changing the culture from one which assumes that everything that happens to us is due to aging, to one that says at any age, well, no matter how many problems you've got, we can live longer, better. So enough from me, and I look forward to questions, criticisms, comments, and volunteering.
Thank you very much, Samir. Great to hear. So who has a question for Samir?
Turn and speak to your neighbour, I think now is what we do.
Stand up, turn to your neighbour, put your hands up.
Gareth, what did you think of it? So the appeal to you is to say, would you like to get involved in some way in these networks? But I'm not sure if there's sort of the professional mix of the audience. But
well, Samir, I can see a fair few sport and exercise medicine physicians, trainees, MSc students, junior doctors, senior doctors involved in sport and exercise medicine.
Yeah.
Some of those who were closely involved with planning the moving medicine program that you discussed.
Yes.
Christina's asked a question. Can I ask about creating purpose aspect, please? Christina, would you like to unmute yourself and ask your question?
Thank you very much. That was absolutely fascinating and inspiring. Thank you very much. You did suggest that you might come on to talking about the element of living longer that requires a sense of purpose. And I'm not, either I missed that or I value hearing more about.
Very well picked up, Christina.
If you've got 30 years from 60 to 90, what is the purpose?
Yeah, that's the big question, isn't it?
Yes.
This is studies of societies with very long active lives, like Okinawa. The Japanese word is ikigai, life purpose. And one of the things the Japanese have done very well is to keep people with roles, employment. And you might have a life purpose for yourself or family, but broader life purposes, I think, is very important. The book by Camilla Cavendish called Extra Time is a very good book. Unfortunately, she's advising the government and social care. And purpose, I think the best purpose is for helping other people. And as I say, what we're doing with developing teams, and this is where it's interesting to think of teams of housebound people, and we don't have it yet, but supposing you had 500,000 housebound people with a treadmill or 500,000 housebound people with a bike, then getting into teams, probably the purpose would be to raise money to tackle climate change. Now, they may want to raise money for Alzheimer's research, but people might be even more motivated to raise money for creating jobs for young people. And then if we had a bit of competition in there too, that's another purpose. So that's what I was meaning, Christina. But I think you'd really enjoy Camilla Cavendish's book called Extra Time.
Thank you.
Thank you, Christina. And Anthony's got his hand up. Whilst Anthony's taking his mic off, Nimalini said, as a physiotherapist working in public health, I stand by every word of what you said and looking forward to checking your websites for more information.
But where do you work, Nimalini? Where do you work?
I work in Kingston upon Thames.
Kingston upon Thames. Okay, well, we're very near there. In London, the place I've got really working is Merton and Wandsworth,
Okay, we're very close. Yes.
which is the catchment population for St George's.
Yes.
And this is part of changing geriatric medicine to population geriatric medicine. That in every geriatric medicine department, there should be one of the team who's got a map on the wall and asking, why are we getting more referrals from middle class areas than from poor areas, for example? So there's a very good physio called Jen Kay working in Merton and Wandsworth. And if you're relentless and contact me, I'll introduce you to Jen Kay. And she's doing population physiotherapy. And I did raise this with Courtney, I remember when we met. I asked him, well, how many departments of sport and exercise medicine are there? And I don't know, is it 47 or 56 or 92? But we should be defining their population. So if, and I think I may be right in this, if there's a department in Nottingham but not in Derby, then either the Nottingham department or the Sheffield department should be considering itself as covering Derbyshire. But you may split North Derbyshire and South Derbyshire. So Courtney, how many networks, how many populations are there if we took, and you're in quite a complex population in North Central London, but how many departments of sport and exercise medicine are there?
I don't have that answer for you at the moment. No.
Okay.
But it's a great question, and that's something that every local area is trying to. There's the sport and exercise medicine community and the faculty of sport and exercise medicine are trying to grow those departments, grow the numbers, and as they expand, they will be able to take this on.
Okay, well, I'll sort that out with Chris and Siobhan from the faculty tomorrow. And then I had a question from a yoga teacher. Yes, certainly. The local networks will be asked to identify yoga, Pilates, Tai Chi, dance, and those are very important, particularly for skill and suppleness, as you know. So that's where social prescribing comes in. So, John, where are you based?
I think that maybe
I'm based here in Leicestershire, in Loughborough.
Okay, well, let's I don't think we've got Leicestershire a member of our first wave, but go and see the active partnership and make sure and find out who's responsible for social prescribing where you work. Here's a question further. Yeah, okay, keep going. I'm looking at the.
So and Anthony Locke's got his hand up. Anthony, do you want to ask your question?
Yes, I mean, I think that these networks will attract those who are motivated, and there are some groups of people who would benefit from such involvement but may find it difficult to do. There are also other aspects of this that because I'm one of the older members of the group tonight, I've been trying to preserve what's left of the brain by doing various activities. So I do little things, like I practiced the piano, the clarinet and saxophone today, but what I can't do is motivate myself to get off my backside and go for these sort of intensive walks, which we've been prescribing. Despite the help that I'm having from two groups of medical students that I correspond with under the Patients Know Best program. And that they've given me targets to achieve. And I'm concerned that I may be overdoing some of the things which are counterproductive intellectually, and that you can get confused by doing too many things. So is there some merit in concentrating on a few and trying to find some means of improving your motivation for doing the exercise, which clearly the two, intellectual and physical, must go in parallel?
Yeah, interestingly, it appears probably the best intellectual exercise is engaging with other people, like the work you're doing with medical students. And the more difficult volunteering is, the better it is for you. I sometimes say to people, even if you do other people no good at all, volunteering is very good for you.
Yeah.
And then as for the exercise, what I'm saying, if I'm speaking to people our age, is, yeah, okay, we need to go for 30 minutes brisk walking a day. And if you're not doing it, we will know, and we'll stop your pension. And the room laughs. And I'm serious, it's for the NHS as well as yourself. Come on.
Yeah.
There's purpose. Quite a lot of comments in the chat about independent teachers. Yeah, get hold of your local social prescribing lead. We need to get this a bit more better organized, but saying that I think we've got not me, but we have got the software cracked. So if someone was in South Tyneside, for example, then the GP in South Tyneside, when they typed in type 2 diabetes or atrial fibrillation, up would pop something from Diabetes UK, would pop Moving Medicine, but up would pop a local list of people who said they wanted to offer a service. Now, we don't at the moment pay for it, but I think with the faculty, we should campaign to switch £100 million from the drug budget to the activity budget. So that's the sort of, we have to do that nationally. So quite a lot of the points that people are raising in the chat are really good independent people who find your local social prescribing link would be my advice, and your local active, it's called the Active Partnership. There are 43 of them, but London is just one, so London's obviously subdivided.
So Muir, in the chat, there's lots of people answering each other's questions and providing links and providing more support for each other.
Yeah.
Esther, are we going to be able to share some of these afterwards?
Yeah, I'll try and
Chris, thank you.
do a summary and share after. Yeah, no problem.
Lovely, thank you. So a question from, I'm really sorry, I'm going to get your name wrong, Ain Tani. You'll correct me, and I'll stand corrected. But a great question. I want to ask, who do you find more difficult to change the minds and the views of? Clinicians or the general population? And not everybody on this call.
Yeah, the more highly educated people are, the more they think they know what they're talking about. So the approach we're taking is we're developing the online learning program for older people. And it's 12 mini modules covering things like what is aging, what is fitness, and then a bit more on strength, suppleness, skill and stamina. Then something on how these affect the brain, how to cope with disease. And so I'm then showing these to people, professionals, and say, well, I know you know all this, but here's what we're showing older people. So it's covert education that we're going for. But I would see the sort of people on this, in this group and the faculty that is having an important missionary function. And that's why I think we've got to, with Chris and with the faculty, we have to get some of the populations worked out. And then you would feel, Chris, Courtney, I'd say, well, within your team, someone should have a map on the wall and should know how many primary care networks there are and what the name is of the relevant part of Sport England. And we don't have a pub we can meet in anymore, but once a month we should meet and we should be working together, and we should be clear who's covering a bit of Hertfordshire. If there isn't in Watford at the moment a sport and exercise medicine, where is the drive and impetus coming in South Hertfordshire? So I look to the people in this as the missionaries, as the Jesuitical missionaries. Other questions or points?
Christina asked, have you got the WI on board?
Yes, they're a key part. I should have mentioned they will be one of the groups that, like the Bridge Club or the mosque, the WI in rural areas is a very important organisation. Yep.
So coming all the way from my aunt in South Africa, she asked, shouldn't we be talking about lifelong fitness in the context of health rather than geriatric medicine?
Yes, well, I think geriatric medicine, I don't know if there's anyone, how old is your aunt, can I ask?
I'll let her on.
Yeah, let her answer. Yeah, it's geriatric medicine did its first job was a very important job of saying that people should get accurate diagnosis and treatment whatever their age. I think they now have to help us with the second cultural revolution, with working with the faculty, which didn't exist, of course, when geriatric medicine started, and saying that whatever your age, no matter how many long-term conditions you've got, you can increase your ability. Lifelong, well-being, these are the words, the key words. Good branding advice.
And Pam has answered. She said, as a physiotherapist for 55 years, I can confirm that coaching is the way to go. It's fun and it's healthy.
Yeah, Pam, interesting is what I found in England was there's about 50,000 physios, and they're busy as hell, working with maybe 3 million people, and there's 50,000 trainers. Now, I'm very interested in this, Pam, because my mum was a teacher of physical education. And in the badge she got in 1928, it said Dunfermline College of Hygiene and Physical Education. But what we've done is that remedial gymnastics and gymnastics are branched off. More in the UK than in Germany or the Netherlands or Scandinavia. So we're trying to bring together, again, physiotherapy and training because the cultures are very similar. And nature prescription is very, very important in terms of green health.
So Muir, taking a slightly different tack, Alison's asked about how do we integrate the ideas of nutrition and the gut biome, where health and exercise are only part of the problem, but increasing awareness of the food we eat.
Yes, I think that's absolutely right. I've tended to concentrate on exercise because one of my principles in public health is to be where the action isn't. And if you look at, say, the Diabetes UK leaflets they send out or the Sunday papers, there's usually 20 pages on food and maybe one page on exercise. So I always emphasize the need to think about diet, but I've just put more energy into exercise. Also with exercise, it's absolutely bloody simple, isn't it, really? I mean, if you were to try to get a single dietary principle agreed, that would be very difficult. But I think the exercise story is very simple. But yes, it's also very important.
I think that I've covered the questions that are there. There is somebody else by the name of Kips.
Yes.
Who happens to be my dad. So he says there is a book from the USA called Younger Next Year by Chris Cowley and Harry Lodge,
yep.
A cardiologist and a retired Wall Street lawyer, which mirrors your points exactly, including the key necessity of being involved in community and exercising every day of your life.
Yeah, I think what we are seeing a much better literature now. There's a book by a woman called Janogly, and she says, being old, get on with it, she says. She's a very good Sod 70, or one of the other books we wrote was called With the Wonderful Green Goddess, Diana Moran, who's still running teaching programs at 81, Sod Sitting, Get Moving. So a different sort of approach. Chris Lawson, Active Suffolk, yes. Chris, you're doing very good work in the villages there, and I visited Suffolk virtually 2 weeks ago. How are we going to change the hearts and minds of GPs to prescribe exercise? Well, are you a GP, Liz Prosser? And we'll see, but GPs...
No, I'm not, Muir. No. I'm not, but I've studied back pain and exercise, and only I think 1 in 4 or 5 GPs would recommend exercise for back pain, and it was those that were active that.
Yeah. Well, of course, the GPs now, poor things, poor dears, they're probably walking 2,000 steps a day. You know, they're in there at 7:30, switch the computer on, and I spoke to one GP whose practice manager had tried to ban him from walking to the waiting room and just wanted him to use the buzzer. And he said, well, I like to see the patients walk in because it helps the diagnosis. So general practice is a very, very challenging job, as is much of healthcare now. So firstly, there's an appeal to general practice to think about their own health and well-being. And secondly, I've said, well, if the GPs would give me 9 seconds at the end of the consultation, I'll settle for that. And the 9 seconds are, well, Courtney, I've prescribed something for your type 2 diabetes, but exercise is very important and you'll be getting a message from us. But even without that, I say we've now got, as soon as the GP's typed in type 2 diabetes, I've got the back office of their information systems planning to send Liz Prosser an encouraging message, and advice and support. Is that Liz Prosser appearing there? Yeah, hi Liz.
Yeah, hi.
What's your day job?
Oh, I'm independent now. I've just semi-retired, but I hate that word. Yeah, I hate that word. Active health and well-being consultant. I am.
Good. No, I think and again, it's practice nurses, receptionists, and also pharmacists. So every time the person goes in to pick up their medication, the pharmacy assistant would be saying, "Oh, how's it going?" And yes, my husband took up park run. I never thought he would do it. It's really made a big difference. So looking for ways we can build exercise into every drug prescription will have an exercise prescription within 3 years.
Fabulous.
So Muir, I'm going to go back a bit to Angela's comment, which Christina Race has echoed later on. Angela says, it seems to me that the positive approach needs to start not once people are declining in fitness, but to instill activity from an early age to get the best outcomes.
Yes, certainly. Again, on my principle of being where the action isn't, then I've been a great supporter of exercise as a preventive activity. But the great thing about that report, Exercise, the Miracle Cure, was for the first time, exercise was seen as a treatment as well as prevention. So absolutely prevention. I think that message has got through, but still exercise as a therapy is not so widely adopted yet.
So Muir, we're going to go back to the GPs. Zara said she's going to take up the mantle. She's going to be the annoying GP mentioning exercising, diet and mindfulness.
Right.
And John has asked, how have you managed to convince the CCGs to invest, and how much clinical evidence did you need to provide to get them to take that up?
Well, within the health service, I'm really only working in 3 parts of England at the moment, Merton and Wandsworth, Wiltshire and Lancashire, and partly because of COVID and vaccination. I spoke to somebody the other day who'd been on phone calls, as I said, from 6:30 on vaccination, that I think I'm going to work more through the active partnerships, but get them to involve the NHS. And of course, the CCGs, I think this is my 28th reorganisation. I remember one reorganisation where the chief executive was reported in the front of the Oxford Times as saying he'd like to reassure GPs and the public they would not notice any change as a result of this reorganisation. So CCGs, STPs, ICSs, ICPs, I'm actually working a bit more now with what's called the ICPs, that's the hospitals. So even the teaching hospitals, their role, we cut them off from their populations in 1990, Chris. Courtney, there was a reorganisation in 1990 in which we cut off the hospitals and made them part of the market. But I think actually maybe the primary care networks and the hospitals coming together is key. The CCG is still quite difficult because the poor people there are still wondering, am I working for a CCG? Am I working for an STP? Am I working for an ICS? What's your day job, John? Type in.
I'm the director of Leicestershire and Rutland Sport Active Partnership.
Oh yes, yep.
We are one of your early adopters.
Great. Oh yes, you're the chap whose accent I can't understand.
Yeah, one of those missionaries.
Yes. and a gym teacher, were you not, John?
Yes, indeed. Yes, the Scottish school, yes. No less.
Like my mum. Yeah.
Like your mother. Yeah.
Great.
So we're does anybody have a last question? I'm sorry if I haven't picked up the questions we're going through. I've tried to look at as many as I can. I think I've got through most of them. There's a
but we'll reflect on this, Chris, won't we? We're going to have a conversation in the next day or two. And so these are very important issues. And I think I would see the national centre, well, I would call it a national node. Chris Clements is one of the leaders of the, it's not a hub and spoke, it's a node. So the faculty and the national centre are important nodes at the national level who I need to make sure are connected in. So I think this has been very good for me, very supportive, and we look forward to the next phase.
Good. So Muir, I'm going to bring it to an end. We've been a very entertaining and quite inspiring joyride through the optimal aging process. Thank you very much. It's wonderful to hear such positive messages delivered by someone who is so clearly passionate about helping people make better decisions about their health. We've noted your messages. We've been writing them down, and there's lots of them in the comments box. Regaining fitness, taking ownership of your health. I liked your smashing care and changing the culture from aging to living longer better. Lots of thank yous in the comments box, and we'll pass this all on afterwards. Before Sir Muir goes, before we say a final goodbye, I would just like to reiterate a comment that he made at the beginning, that the Faculty of Sport and Exercise Medicine and the National Centre for Sport and Exercise Medicine are running a series of seminars on physical activity through different health conditions in April, so keep your eyes peeled for those. And lastly, to say, as everybody is saying in the chat there, thank you so much. It's been a fascinating evening. We've really enjoyed it. Thank you to everybody for your participation. There's been a great amount of chats and some very good questions. And have a nice evening. Enjoy the travel home this evening, far better than most conferences. And to everybody, have a nice evening and stay safe. Thank you very much.
Thank you very much.
Thank you for organising it.
Yeah, thank you. Yeah, thanks, Chris and the team. Bye-bye.